anyone tell me?
Some people have special veins.
Yeah.
Needle, yeah.
So we have 1 cc, half cc. What's the difference? Who knows?
The needle is thinner.
False.
It's
It's
more
just
like
the barrel size. So this barrel, 1 cc, holds 1 cc of fluid. The other one is a half cc, half the amount of liquid. The actual needle point is displayed here, 28.5-inch gauge. They're actually the same on the half cc, same needle gauge. They might look a little different because they have a small bevel. It's shaped differently, so it kind of appears shorter, but in fact, it is the same needle tip. It's just the barrel size.
Oh, really?
So if people ask you for a small rig, sometimes they understand that that means volume, but most of them, they do think that the needle is small.
Yeah, I heard that it doesn't blow the vein like what?
It's not true.
So it has nothing to do with the
That's
vein?
what I always
It has nothing to do with the vein. That's what they said. Some people have.
No, it's the same needle tip. It's just for volume.
Just
Yeah,
volume.
yeah, and it's kind of fascinating how long that's kind
Okay.
of gone on.
I
Like a
know
lot of
it.
ladies ask for half cc because it's kind of they think it's a daintier needle, or but in fact it's the exact same needle tip.
You know, that's interesting. I was in reduction classes and they said that was because of the vein.
No, it says right on the package. The needle gauge point is the same. Okay, so
Very good.
different size barrels: 3 mil barrel, 5 mil barrel, big barrel. They don't give out 10 mils anymore. Coastal Health found that people were using them in non-safe manners. They were using them more for methadone, liquid methadone, or for mixing pills and then drawing out of them, like using the 1 cc to draw out of a larger barrel, which contained a lot of liquid. Right? So a lot of sharing. So maybe someone would fill up a 5 mil barrel with some dillies or whatever, and then people are drawing.
Capacity.
Yeah. So they took the 10 mils off the market just for safety. I mean, there's no reason why you can't get away with using a 5 mil for whatever your purpose. That's so much volume, right? Like, so we're going to talk about the needle tips that we attach to these barrels. Many kinds. They all attach to both barrels. They're all universal. And once again, the needle points are displayed on the package. With these snap-on needle tips, the lower the number, the larger the gauge, exactly. So it starts with what we're allowed to get is a 20 and 1/2 inch, which is a harpoon for muscling. This is for steroids, generally. I mean, that's what that needle should be used for. This is not an intravenous needle. It should never be used for that. So if people are coming in asking for a 3 mil or 5 mil barrel, and they might call it a harpoon or a big rig or whatever, or they'll say the number, you're going to maybe ask them, are they using steroids, what are they using it for, because you want to make sure that they're not using this for the wrong reasons, specifically for muscle. Pardon? Yeah, I mean, we can talk about what you guys know alternate uses for a lot of this stuff is, because, I mean, a tie is not a tie. A tie is a belt, a tie is a headband, a tie is a door hanger, a tie is a plant hanger.
Sorry, so what size is that one?
That one was like 20 and a half. You know, I can pass these around.
Strictly for any muscular.
Yeah, and there are
diameter or length? Diameter?
Right. Okay. Oh, here's an 18. So this one's even bigger. Once again, that's for muscling. And then the intravenous tips start at the 25 gauge here. So these are blue, 25 5/8, 25 1 inch. The 1 inch is pertaining to the length of the needle. So we're getting into the intravenous tips now. So these can be used for anything that people are going to do. Would you like to see your needle? The most common are these brown ones, 26.5 gauge. That seems to be what most people ask for. Those in the 27.5, which are great. And this is the closest gauge to the 1cc and to the half cc, so they're the most familiar to people.
So that's for the muscle.
Nope, this is intravenous. This is for veins. Yeah.
Oh.
Yeah. These are small enough that you can use them in.
The higher the number, the
Yeah.
easier it is to use,
Yeah. Or the smaller gauge.
or the smaller.
Yeah. So just if you're ever working in a needle exchange table or anything, it's just good to familiarize yourself with all the different gauges and barrels, because some people are very particular about what they want. And it's important to, if you don't know what they're using it for, and it's the first time encountering that client, you can ask them. Most people aren't shy about what they're doing.
Do you actually
Tell you.
deny it if it's for steroids, or?
No, I get big muscly guys coming in all the time, and I pretty much don't need to ask, right? But the first few times, I'm looking at, this one guy, he's a big guy, and I'm wondering, like, what are you using these for? He's like, steroids, brother. Okay.
Oh, you're just saying that in case they're actually using the big gauge to do intravenous and it may do more damage.
You never know what people are doing. And some people, it's fascinating, they've been, addicts for a long, long time, and they're still maybe
Taking chances.
taking chances, doing things maybe not the safe way.
So you're using the big needle to basically expand the veins. The lower gauge.
Well, yeah, I mean, you can't really. I mean, you could try to get that in the vein, and you're going to go right through it.
It's going to be hurtful.
We're gonna blow it. It's gonna be-
Well,
Alcohol swabs. Okay, who knows the proper procedure for alcohol swabs? Okay, anybody?
I do.
Shout it out.
Before and after.
Before and
And after.
circular from the inside,
Yeah.
working your way up. All right, so you have a clean area to do your injection.
It's not for after.
It's not for after.
No,
Actually,
it causes
yeah,
scars
yeah, and it
after.
causes scars if you do it.
We had one of the guys tell us that when you do the alcohol swipe, what you're doing is just pushing dirt around it,
Yep.
and then you should use 3 or 4.
or wash before.
I mean, ideally, you're going to be washed with soap and water before.
Ideally.
Ideally.
You can't harm you to use 12 of these things before if your arm is dirty. Nuts. And you get that arm clean before. Some people just think that'll do it, I mean, you can still see dirt. There's dirt. And so for alcohol swabs for other things too, people are going to come in, abscess, wounds, cuts, and they're cleaning themselves with these. You're gonna try and advise them that's not the safe practice. I mean,
Soap and water.
it might kill some germs, yeah, but it's also gonna kill your looks, man. You're gonna end up with a Freddy Krueger face. Yeah. Soap and water, soap and water, soap and water. Best thing you can use. And if you need further medical attention, once again, we always try to refer people. So if someone has a gash and they're asking for a Band-Aid and an alcohol swab, that's a Band-Aid and alcohol swab. You need medical attention. You need to go to inside some nurse, you need to go to the hospital, you need to go to the clinic. So don't send them off with a Band-Aid and a swab and say their face.
So the alcohol has a tendency to dry out your skin. When your skin becomes dry, it has a tendency to break, and that's when you start getting infection.
Mhm.
Is there such a thing as overuse of alcohol?
Sure.
Oh, yeah. And what is that point?
When you're using your alcohol swab as a wet paper towel kind of mentality,
Yeah.
that's too much.
Yeah, it kills you have good bacteria on your
Exactly,
skin as
yeah.
well, and it
Yeah.
kills the good bacteria that you have as well,
And
that you
dehydrated
need.
skin too.
Yeah, yeah, and I saw a gentleman come in the other day and he had terrible cracked heels, he had swamp heel or whatever, big cracks in his heels, and he's using the alcohol swabs before I saw him. And unfortunately he wouldn't listen to me, set in his ways. Trying to educate people with that kind of stuff, because you're the one who can do that. You're the one at the table, and you're the first point of access for this person. Even if they don't listen to you, you gotta try, right?
Actually, for cuts, they say you should be using saline solution or just, if it's actually open, it should be saline solution or just
If
water.
it's a serious cut,
Not-
I mean,
not
you gotta
even soap.
refer this person to
Yeah,
someone who
refer 'em, but
who is trained to handle a serious cut. I mean, we're all trained